I'm so honored to serve as president of the ASDS. It marks the high point of a long journey for me, from a law student to corporate lawyer to my pre-medical studies in medical school, from internship, residency, and fellowship training to my current position as director of laser, cosmetics, and dermatologic surgery at Massachusetts General Hospital. Now I have the opportunity to serve the society with the advocacy skills I gained as an attorney and the medical knowledge that I possess as a physician. My first experience with the ASDS was as a third-year resident on a travel grant to present a poster at the annual meeting in New Orleans in 2003. That began my association and commitment to the professional society for which I care most. There is not a day that I'm not grateful that I'm a dermatologic surgeon. No society reflects my specialty or represents our values as much as the ASDS. It's also a family affair for me, as three of my siblings and my wife are all dermatologists with a mixture of medical, surgical, and cosmetics, both in private practice and academic settings. Today, we're in the midst of a great pandemic, the likes we have not seen since 1918. This represents a great challenge to the health and well-being of our nation. Our society has been challenged in ways that I have not seen in my lifetime. The same can be said of the practice of medicine and dermatology. One need look no further than the fact that we're meeting remotely to see the effect of the virus in our personal and professional lives. Certainly it is a challenging time, but with challenges come opportunities. And I strongly believe now is a time of opportunity for our specialty and for the ASDS. It is a crucial time for our outreach to underserved communities, including physicians and patients, to create a more inclusive organization. In these times, the ASDS has never been more relevant to our specialty and our practices, whether your practice is surgical, cosmetic, medical, or a combination of the three. 2020 to 2021 can easily be the year that our society grows stronger and larger than at any other time in our history. Here are a few key points. First, the ASDS will serve to help the financial and practice needs of the membership during the pandemic. Whether in academics or private practice, our members are universally facing new and unprecedented forms of hardship and stress. The ASDS is there to help. As a society, we will accelerate assisting our membership by sharing best practices with regard to the financial strains and the safe and careful practice of our specialty in a time of pandemic. We will accelerate our multiple educational offerings online and on social media. No one is better equipped to help our members than our own membership. We will all benefit from these resources and communicating best practices with our colleagues. We encourage all members to join in this effort. Together, we will rise above the challenges of this difficult period. Second, our specialty is under attack from many different threats. Two of the biggest threats are social media and encroachment into our specialty by non-dermatologists, and even more frighteningly, non-physicians. As dermatologic surgeons, we are the foremost experts in the health, science, and beauty of the skin. Our members have invented the technologies, pioneered the techniques, and created the new medications that have transformed our ability to treat skin cancers, skin health, and skin beauty. However, that message is being lost in a blur of TikTok videos, Instagram posts and reels, tweets, blogs, and Facebook groups. At this time, I fear we are losing to the non-experts. We need to combat this slow but pernicious drift from our specialty care to the lowest common denominator. One quick glance online, we can see the race to the bottom that is threatening our specialty, and more importantly, our patients' safety. Each day, I see grossly inaccurate and misleading and false information, not to mention lies about training and qualification to perform these procedures. Too often, I see patients injured by safe and effective devices invented by my dermatologist colleagues, performed by poorly trained physicians and non-physician operators. Studies have repeatedly demonstrated a direct link between patient injury and the training of the individual providing the treatment. At this time, this important message is being crowded out by unskilled but media-savvy influencers. We are the skin experts, from skin cancer to lasers and injectables to topical skincare. In fact, our membership overwhelmingly invented these procedures and treatments. It is time that we used our expertise in dermatology and our own considerable social media outlets to educate and inform our patients. We need to be their trusted source of information. Between our ASDS membership, we reach millions of patients daily. We need to aggregate our personal social media accounts to leverage our expertise for the benefit of the public and its safety. If we post educational content as a group, we reach millions with a unified message that competes with the beauty bloggers and non-physician providers. We need to make certain that we outreach to underserved communities as well. No one should pursue a cosmetic, dermatologic, or skin cancer treatment without the benefit of our content as dermatologists and dermatologic surgeons. Further, we can educate the public as to the importance of medical training, specialty training, and subspecialty training. Our patients need to see the value of our medical, surgical, and aesthetic acumen. Third, this year will be devoted to reaffirming the scientific and educational missions of our society for the benefit of our attending physicians, fellows, and residents. It will be an unprecedented year for ASDS education. Given the transition to virtual platforms, this year will be the most prolific by far for educational events from the ASDS for all of our members within the United States and increasingly internationally. As always, we will push the envelope for new innovations and techniques, the lifeblood and future of our specialty. At the same time, we will stress basic training for the early career dermatologists within our field. It will also provide more emphasis on the treatment of skin of color, something of which our field has lagged to the detriment of our patients. We will gather the world leaders in our specialty to provide all of the above. To conclude, these are uncertain times. We face a pandemic, economic disruptions, attacks on our specialty, and a litany of other challenges. As a society, these challenges represent an incredible opportunity to face these in an inclusive and professional manner that elevates our specialty and patient care. For this to be successful, we will need all of our participation. You can do it on social media, sharing personal medical or office tips, or by reaching out to underserved communities. I am deeply optimistic that the ASDS, as well as our specialty, will emerge stronger, more relevant, and more impactful in the next year than at any time in our history. It is therefore with a confident belief in the ASDS and the field of dermatology that I begin to work with you to reclaim and elevate our specialty. Thank you.